Testing of the temporomandibular joints in relation with the upper cervicals. The first test is a bilateral decompression test. So we fix the skull with thenar hypothenar on both sides, and with my medius and ring finger, I bring both mandibular branches in a caudal direction. Let's say that this is difficult. When this is difficult, we are in front of a bilateral compression lesion of the temporomandibular joints. Then we also often feel pain when the patient bites on the muscular origins. In these cases, the patient can also often not open the mouth very wide. These bilateral compression lesions of the temporomandibular joints are often together with a high cervical compression lesion. The second test is very similar. We do the same. So we bring both mandibular branches in a caudal direction. Let's now say that one side goes very difficult. For example, on the right side. Then we talk about a unilateral compression lesion of the temporomandibular joint, in my example on the right side. If this is the case and the patient opens her mouth, then we see a deviation of the chin towards the compressed side. The relation with the upper cervicals is very often clear. When there is compression of one temporomandibular joint, for example on the right side, we often see an occipital side bending to the right with some shift to the left. The next test. We bring both middle fingers posterior of the mandibular branches and we ask the patient to open the mouth. We push both branches in an anterior direction. Let's say that this is difficult on both sides. When this is difficult on both sides, we have a bilateral posterior lesions of the temporomandibular joints. When this is the case, the opening of the mouth will also be limited. In these cases, we find rather frequently in the upper cervicals a flexion lesion, with the patient lying with a double chin. The next test is much more an observation. We observe that the patient lies in a strong extension with the upper cervicals and with an open mouth. This is what we call a passive bilateral anterior lesion. These patients very often eat with their mouth open, so the mouth hangs open. Children with this type of lesion often lose saliva through the mouth a lot. This was called a bilateral anterior lesion of the temporomandibular joints. The next test is very similar to the last one. So again, we bring both middle fingers posterior of the mandibular branches and we ask the patient to open the mouth. We follow these branches and push a little bit in an anterior direction. Let's say that this is difficult on one side, for example on the right side. When this is difficult on one side, then we talk about a unilateral posterior lesion of the temporomandibular joint, in my example on the right. We often then see again a deviation of the chin when the patient tries to open the mouth. This unilateral posterior lesion is often related to a high cervical, most of the time the atlas, to a high cervical rotation lesion.